Ended.
Good evening. Welcome. Thank you for joining this telephone town hall meeting to talk about the City of Burlington's response to the COVID-19 crisis and really what comes next and the restart phase of this emergency. At both the state level and the city level, we've been starting this conversation over the last week or so, and we are excited to continue that conversation, really deepen it tonight with a couple of experts. We're able to have this conversation now because after nearly 2 months of sacrifice, we have flattened the curve of the first wave of COVID-19 infections in our community. We've also used this time during the shutdown to build out our public health infrastructure, improve our understanding of the virus and its associated risks, and to lay the groundwork for a slow and careful reopening of our community. As we do that, and as we, I think, all have some hopefulness about what that means, at the same time, we are very aware that the battle against coronavirus is far from over. Indeed, it's likely that we're still in the early stages of this pandemic, and we're going to need to figure out as a community how to manage the risks of the virus for many months to come as we attempt to suppress it and live with it and turn on more and more of our economy while the threat of the virus still remains. Tonight, we're here to talk about exactly how we do that. And I'm very excited to be joined again by two leading experts at the national and local level. Here with me tonight is Dr. Joshua Sharfstein, who is a public health expert who's been extremely active in helping local leaders understand how to respond to this crisis. Dr. Sharfstein oversees the Office of Public Health Practice and Training at the Johns Hopkins School of Public Health and directs the Bloomberg American Health Initiative. He previously served as a Commissioner of Health for the City of Baltimore, among many other roles. And Burlingtonians may remember him if you came to our town hall here in City Hall in March of 2019 to discuss the opioid epidemic. Dr. Sharfstein was generous enough to travel up and join us for that event. We are also joined by Dr. Stephen Leffler, who has been a real leader in the local response to this pandemic as the President and Chief Operating Officer of the University of Vermont Medical Center. We are very fortunate to have you both. Thank you for taking the time, and let's dive right in. Dr. Sharfstein, I want to turn it over to you and maybe give us sort of an overview of the kind of when and how to restart questions.
Sure. Well, thanks so much, Mayor, for having me. It's good to see Dr. Leffler also, and to travel virtually to Burlington again. This time with warmer weather than I remember it being the last time I was there for your event.
Not a whole lot warmer here, but modestly so.
Okay. So the situation we find ourselves in now has sort of good news and challenging news. The good news is just what you said, that the stay-at-home kind of orders worked. We were able to flatten the curve. We did not have in the United States the tragedies that Italy saw by and large, although New York was really pushed to the limit, but many, many lives were saved. And now we're dealing with the fallout of the economic damage that has been caused by this pandemic, trying to figure out what the path forward is. And it's challenging because in many areas of the country, there's still quite a lot of cases. In some areas, the cases are growing. And so that can make it quite dangerous for doing too much reopening too quickly. Even in areas where the number of cases has come way down, there's still a risk that it will start up again. And because of the potential for exponential spread, where one person gives it to 2 or 3 people who give it to, also 2 or 3 people each, pretty soon you get generations of infections and it can become overwhelming. Pretty much the only thing that we did to slow the spread of infection was try to keep everybody apart from everybody else. So if we let people all come back together, then we're going to have undone everything that worked. So the challenge here is to continue to buy ourselves time for science to come to the rescue with a vaccine and some treatments. But this time, instead of just keeping everyone apart as much as possible, allow people to very carefully re-engage while keeping a very close eye on infections and developing and using the response that's needed to control outbreaks before they get too big. So to break that down, we want to be able to open slowly, maintaining the conditions that keep the virus at bay. We know the virus loves to jump from person to person when people are within 6 feet of each other, when they're in each other's airspace, meaning like right pressed up close. Breathing releases these droplets that can be inhaled by the other person, or they can touch them. But if we stay apart, if we wear masks, if we stay 6 feet apart, and if we put up barriers, and if we do things to reduce the chance that people are in that kind of close contact, we're depriving the virus of a chance to jump from person to person, and that slows the spread. But the virus will succeed sometimes. And when that happens, we need to have a public health response that identifies the infection, that finds the people who might have been exposed, and it gives them support to isolate themselves so that there isn't the chance for the virus to keep moving. We need to break the chains of transmission when they happen. So careful reopening, public health response to break the chains of transmission. And when you combine those two things, then hopefully we will be able to achieve essentially a new normal where a lot can happen that is important for the economy and for our lives, and we can continue to buy time. I don't think it's going to be going back to the normal life, but a lot can happen, and we're essentially buying time for these promising therapies to hopefully start to pan out.
Great, thank you, Dr. Sharfstein. I do want to say to people who are listening on the telephone, you can hit *3 and kind of get in the queue to ask questions. We will open this up for questions in a few minutes. Before doing that, I want to build a little bit on what Dr. Sharfstein just said in this graphic here in front of you, and really kind of speak in a little detail to why we think that we have achieved those 3 conditions laid out there for when it is proper to start thinking about, and in fact to do more than start thinking, but actually to start reopening the community. This graphic really shows how Vermont, somewhat unusually in the continental U.S., is really just Vermont and Montana. This is something from the COVID Act Now website, which makes an attempt to assess the various levels of readiness for reopening of different states. Vermont is doing very well on that metric, as you can see in green. One of the metrics that goes into this visualization and this analysis is the infection growth rate. You can see there for some time now we've had the infection growth rate estimated to be well below, well, not well below, but below 1 new infection for each infection that we find. And that has been the trend going back into the middle part of April. There's some other metrics we've been looking at. We'll advance, and you can see these are the total tested infections in Chittenden County going back to mid-March when the emergency began. And we can see that really since the middle of April, we have had this standard med of a low and generally declining number of new infections.
Yeah.
Day to day, we've had a number of days in the last week where there have been 0 new infections in Chittenden County, and it's been pretty low-level infections going back again to mid-April. I'll let Dr. Leffler speak to this slide. This is data that comes from his operation here at the UVM Medical Center. And Dr. Leffler, maybe you could speak to this slide as well as sort of the third condition of the sort of general readiness of the healthcare system for reopening. Are you in good shape? Are you able to kind of take on new challenges that might come with the restart?
Thank you, Mayor. So yes, the news is that we are in good shape. The previous slide that you saw that shows that Vermont's infection rate is below 1 is well represented in our data. We had no new positives in the state of Vermont yesterday and only 1 new positive today. Currently at the UVM Medical Center, we have only 2 positives. Our patients under investigation has jumped up a little, but that's because we're testing people that we're admitting now. So it's that number will be harder to use going forward. But we only have 2 people in the hospital. We have no one currently in the intensive care unit with COVID and no one on a ventilator. So to Dr. Sharfstein's comments, the mitigation that we did in Vermont that bought us time to blunt the curve so that we could have enough PPE, enough testing, and build capacity has served us well. We've used that time efficiently, and so we have much better supplies of PPE than we did 8 weeks ago. We have a much better supply chain to keep it coming. We have much more testing in the state than we had 8 weeks ago. We have more ventilators available. And so we're preparing for the next phase of this when COVID is part of the new normal. We're planning for a future when we regularly have some COVID patients in the hospital and we have ICU capacity and ventilators for them, but we're doing other care as well. We're not shutting down everything elective like we did in the first phase of mitigation. And we plan over the next couple of years that we will have occasional spikes. Dr. Sharfstein's comment, we'll see a bump of cases, and we'll have to do a strategy of quarantining those people, doing tracing back to individuals and get everyone in quarantine so that it doesn't turn out to be our spike. But we're very prepared now. And as part of that, we are starting to resume elective visits. Tomorrow is our first day of elective surgeries. We're ramping that up gradually over the next couple of weeks, but we're doing it in a new normal. We're still continuing a lot of social isolation in the hospital. We're seeing patients in a different way to keep them and our staff safe. And we're very, very carefully tracking our PPE to make sure that we have good supplies 3, 4, 5 weeks out. So we're ready. The hospital thanks Vermont so much for social isolation and mitigation, and we are ready to move forward.
Great. Let's go now. We have a graphic that has been developed that, after all this talk about testing and contact tracing, I kind of had a vision had an understanding of what we were working towards, but this graphic, as well as the kind of strategy that goes along with it, was really clarifying for me. And I do have this sense that as much as we kind of flatten the curve was the kind of catchphrase of the first stage of this epidemic, box it in may become the next way that we kind of simplify what we're all trying to do collectively and what the government public health functions are trying to do. Dr. Sharfstein, could you expand a little bit on this graphic and how this is supposed to work?
Sure. Thanks for asking. So this is the box it in graphic from Resolve to Save Lives. And the concept here is, as Tom Frieden likes to say, if we can box in the virus, then we can get out of the box of having to shut down the economy in order to control its spread. And so step one there is to find where the virus is. And that's what testing is all about. And it's great to hear Dr. Leffler talk about the progress that you've made in Vermont with testing and with protective equipment. Then second, when you find people who have the coronavirus infection, it's not just telling them that they're infected, it's helping them. It's getting the medical care that they need, and also making sure that they're able to safely isolate by themselves so that they're not posing a risk of infecting others. But the truth is, when you find them, you can help them and they won't be a risk for further infecting others, but they might have already infected other people. That's the idea of contact tracing. That's step 3, the find. You want to say, okay, if you were sick, when did your symptoms start? And you go, well, maybe my symptoms started Monday. Then you go 2 days before that, so that would be Saturday, and you want to find out who you might have exposed potentially because of close contact on Saturday, Saturday night, Sunday, Sunday night, and Monday. And so those people then get found, and they need to, in step 4 here, quarantine themselves from 14 days from that point of contact. And so you need to be able to do that. So that way, if they become infectious, the virus has no place to go because people are already quarantined. And just yesterday, Mayor, we launched a free online contact tracing course at the School of Public Health. People can find it on the Coursera platform by typing in contact tracing Johns Hopkins, and already have 10,000 students in the course. It really explains this process, and we're hoping that people will get the training and be able to join programs at the local or state level that are contact tracing as part of the public health response, because it requires a lot of people. If you have a number of cases, you have to be able to find all the contacts, encourage them to quarantine, and then you can really control the spread of the virus. One last quick point, which is it's pretty hard to find everybody. But the important principle here is if you find most of the people, you can have an enormous impact on transmission, because transmission can be exponential. Every one person gives it to 2 or 3 people. If you can cut that back so every one person maybe gives it to one person, so it's not perfect, you can dramatically affect the trajectory of the epidemic and save a lot of lives.
Can you speak to the isolation strategy a little bit more, and how you think, it's my sense that the way we've been pursuing this in America is pretty different than some of the Asian countries that had to deal with the virus a little bit sooner and that have had more experience with these pandemics than we have. There's been a real reliance on isolation in the home, and clearly that can work for some people. But what do you think are the elements of a successful isolation strategy?
That's a great question. So a successful isolation strategy is a lot more than telling people you need to isolate yourself, because there are a lot of things people need. They have to have steady access to food. They need their medicines. And they need to be able to have enough space to isolate themselves, with hopefully their own bedroom and bathroom and eating on their own. Now, if they can't do that, let's say that they're in a house with 10 people and they have 2 roommates, you can tell them to isolate themselves, but they can't do it at home. So in that situation, it can be very helpful to be able to move somebody into, for example, a hotel for the time period until they feel better. So having resources to help people is very much an important part of this successful box it in strategy. That's the idea. Now, some countries will say, we want everyone to move out and go into a hotel. And that is probably not practical for the United States, but having the option to do that is, I think, pretty important for this to be successful over the long term, or at least as successful as it can be.
We did have that option set up here in Chittenden County. There was a hotel, actually in South Burlington, just on the other side of the city line, the Holiday Inn. The launching of that site coincided almost, to the day with when we got onto the downslope of the number of new infections, and it has now been closed because there wasn't a lot of utilization of it. But it's one thing I've been in pretty regular communications with the state of Vermont about, is to ensure that we, in some ways, I think these isolation and quarantine strategies are going to be more important in this coming phase than they were in the kind of stay home period, in that the risk of transmission is even greater, and getting isolation and quarantine right is even more important. So The state does have a Rutland area facility set up and ready to receive patients, and we will see, I'm going to stay engaged with making sure we do everything we can to make that a successful strategy. There could also be supports here in the community that are necessary for helping people isolate if they do choose to do that in their home. And that is something that we have an ongoing conversation with the state of Vermont about. So to your point, Dr. Sharfstein, we are still buying ourselves. There's still elements of this that we're building out and we'll be building out for some weeks, even months. Is it your sense that, in a place like Vermont, where clearly we've kind of gotten through the first wave and we've got this suppressed back down to very low levels currently, do you have any optimism that it's going to be easier to suppress the virus in the warm weather months when we're spending more time outside? Do you in any way think the big challenge is going to come in the fall, winter, and that we have some time to keep building this if we're going slow? Is that
what I would say
how
is
do you think this is going to roll out?
You're in a good position because you have so few cases. So you want to start as low as possible. I'm worried about places that have many cases and they're opening up. And so that just gives so many opportunities for the virus to spread. You've gotten it down pretty low. And so that puts you in a very good position. I don't know what the weather is going to bring. I mean, you can tell me, I'm a little worried that, if you have a cold winter in Vermont, everybody's home. So that it's not that much of a risk that the virus jumps from person to person. Then you have a nice temperate summer and everybody walks out and they're in close contact with each other down by your lake or wherever. That could actually give more opportunities for the virus to spread. So I think people have to be wary and on guard for the summer. In Vermont, they have to practice social distancing. They can't say, well, glad that's behind us, because it is not behind us. And this is a very, very, I would say, insidious virus, very contagious. If you let your guard down, it can take advantage of it. And so I think it's very important to maintain a high level of preparedness over the summer.
So let's go. We have just, I think, one more slide, and then I want to open up to other questions. A key element of this box-it-in strategy and this sort of suppression strategy is that we're going to need to continue to have a real focus on protecting the most vulnerable. And I know this is something else that the Johns Hopkins School of Public Health has been incredibly forward-thinking on. Dr. Sharfstein, do you want to speak to these strategies about protecting the vulnerable?
Sure. Well, I think that we've seen in my own state of Maryland, many other places, that nursing homes in particular are extremely vulnerable places for this coronavirus. We know that the illness itself is more likely to be serious or even cause death in people who are older, as well as people with chronic health conditions. And then when you add that they are people like that living together where there's easy transmission, you get the contagiousness plus the lethality right next to each other. And that's very, very serious. You also can see that in shelters for people who are experiencing homelessness, particularly when people are older or have chronic illnesses. And you can see that to a certain extent in jails and prisons, particularly if they're older prisoners. So it's all those places are very much at risk. And, you don't want to be on a don't call me, I'll call you kind of basis with these facilities. It's very important to be in touch with them to make sure they have adequate PPE, just like the hospital, so they can protect workers and not have cross-contamination within facilities. There are a number of other important infection control steps that they can take. And if there are cases, it's very important to test widely to be able to pull together the individuals who have the illness or are testing positive together, and hopefully keep the virus away from the others. So it's a major challenge in these areas, and I don't think anybody has completely come up with a solution yet, but there are clearly a number of important steps to take. I think, being aware of that is the first step. I think the cities and the counties and the states can all kind of go the extra mile and really support these very vulnerable facilities.
Yeah, we're definitely aware of it here in Burlington. Although we did have generally, I think we feel that we've weathered this first phase of the pandemic relatively well compared to a lot of communities. We did have two really devastating outbreaks in nursing homes in Burlington. When they happened, the UVM Medical Center really helped step up and provide the response that helped those situations from getting even worse, kept them from deteriorating to the point, they continue to be staffed and have PPE available to them. Dr. Leffler, can you speak to that effort and any kind of ongoing engagement between UVMC and this? We have a lot of these nursing homes in Burlington and the region. You want to speak to the medical center's support of those facilities?
Yes. So once again, I think this is one of the powers of Vermont, that we all are connected and are very collaborative. And so when the first cluster of cases happened at Burlington Health and Rehab, we worked with them to figure out how to contain the cases, to keep people together. They did a great job caring for people there in their homes and were able to maintain most of them there. Few of them needed to come to the hospital. That's better for the healthcare system. It's better for stopping the outbreak there. And so we partnered with them to do that. When Birchwood's cluster happened, they actually had enough of their staff that became positive for COVID and enough that were in quarantine that they had a couple of days where they were going to be short-staffed. They would have had to do some kind of drastic action without help, either empty their nursing home residents from their homes in the nursing home back to the hospital or to one of our surge facilities. And so partnering with them, we made the decision that for a number of days, we actually helped staff Birchwood with our nursing staff. And when their workforce started being able to come back, we brought our nursing staff back. But because they had ongoing challenges with patients, we had our palliative care team go down there and provide 24/7 coverage for, I think it's 6 weeks, to manage people there that were in acute crisis and help them manage the illness. And so I think that was a great partnership. We learned a lot from both of those. We learned how to do it better going forward. And so when and if it does come to our other nursing home partners in Chittenden County or in the state, I think we know a lot more now about how to do that well. And we hope it doesn't. And I think our nursing homes in the state have overall done a very good job of keeping COVID-19 out. But if there are more cases, we understand a lot more about how to do that now.
Yes, understand a lot more how to do it. I think the testing protocols are, really as a result of those two experiences and the increased testing, I think we got a lot more clarity about how that will function. We know that protecting the most vulnerable in this epidemic is going to continue to be very important. We know the elderly face really acute risks, particularly in these congregate care situations. At the same time, we also know we got to be thinking more broadly than that about who is vulnerable here. The data that has come out, again, particularly around other parts of the country, about how communities of color are being real disparities in terms of negative outcomes from this pandemic on communities of color versus others, for a whole variety of reasons, stemming from just disparities in the quality of healthcare to disparities in the jobs that people have, and just more people of color being on the front lines of this emergency and more. So Burlington has tried to deploy a variety of strategies in the first couple months of this epidemic to stay true to this principle that I think Burlington as a community is very committed to, of protecting the most vulnerable and really ensuring that in this pandemic we aren't leaving people behind. And some of the examples of this I did just want to speak to. briefly, in the early days, just a couple weeks into this epidemic, we set up a COVID-19 Resource and Recovery Center, which I do hope anyone watching, listening is aware of this resource. This is there to provide one-on-one consulting and help to any Burlingtonian who needs it. And you can reach out, you can go to the website where there's at this point, just an enormous amount of information that you can access yourself. We also are responsive to emails and phone calls within the standard is to try to get back to people within 24 hours. What help people need has evolved and changed in different parts of this emergency so far, and I expect that to continue over the months to come. The Resource and Recovery Center, we're committed to keeping it there and it to being a help going forward. We have also launched a new program called the Trusted Community Voices Program to better connect the city with immigrant and refugee communities in Burlington. We have been a refugee resettlement community for more than 30 years, and it's brought remarkable diversity to Burlington versus where we were 30 years ago, and enriched us in so many ways. And yet, going into this emergency, our tools for communicating with those communities, immigrant communities, were imperfect. And in recent weeks, we've launched a program where we have hired individuals that come from these communities to give the city a better two-way communication, so a better way of reaching out to these communities and getting feedback back. We had an example of how that's already kind of changing the city's response to this emergency last week when these new individuals advised on how we should be distributing the masks that we have been building and handing out to first essential workers and now to any Burlingtonian who wants one. We are getting these masks out to locations that we've been advised that are frequented locations in consultation with these new advisors. We have created a seniors providers working group. So to Dr. Sharfstein's point, we're not waiting for these nursing homes to call us. We have a regular communication going. We are checking in on a weekly basis about how the quality of, where their supplies are, what new challenges they're facing. It's also become a place for these different organizations to share best practices among themselves. We have specifically been reaching out to unbanked businesses. A lot of these are businesses that come from these immigrant communities, and the unbanked businesses, it was particularly hard for them to access the relief from the federal PPP program. We were able to make a little bit of progress connecting these unbanked businesses to that program. We also are looking at some follow-on programs with local resources to make sure that they are getting some relief through this. And then finally, did want to note, Dr. Sharfstein, we have from the early days of this emergency been very focused on the challenges of the homeless, and in working with the state. The state has really been quite, it's really quite impressive what the state has done to open up hotels using voucher programs. And actually, until this week, we had a pretty innovative program going on in North Beach here in Burlington too, where we had rented RVs and people moved from our low barrier downtown shelter into that facility. So we're going to continue, and this is the beginning of the list from my perspective. I think we're going to have to keep expanding these efforts to protect the most vulnerable in the weeks and months ahead. With that, I think we should go to the phone lines before we lose Dr. Sharfstein. And I think we have Amy on the line who has a question about childcare. Amy, can you hear us? And hit *3 to ask your question. Amy, can you hear us? I think we can hear you.
Hi.
Hi, go ahead. You're on.
Hi, this is Amy. Can you hear me?
We can. Welcome.
Hi, can you hear me?
Amy, we can hear you. Yes, go ahead and ask your question if you can hear me.
I can. Thank you so much. I really appreciate the town hall and the panelists for their insightful words. I had a question about childcare. I know that one of the panelists talked about the disease loves to jump from person to person within 6 feet. And we know that this isn't over. This is kind of the start of all of this, or we're partway through. And we're being thoughtful and intentional about the slow reopening of our society. And so I'm just curious, we know that the governor has talked about a June 1st date for childcare to reopen. And we know that kids won't effectively wear masks, let's get real. They won't stay within 6 feet of their friends. And just thinking about some of the information that's coming out of the UK and New York City connected to young children and the Kawasaki-like illness that they're experiencing. I'm just wondering, do we have a good enough understanding of the disease's impact on young children to reopen childcare and reopen it so quickly, with the idea that we'll start with 10 kids and quickly move to 25? I'm a professional in the field, but I'm really wearing my parent hat as a parent of a 4-year-old. So just curious about what the panelists' thoughts are on that.
Great, Amy, thank you. I know that's a question on a lot of people's minds. Dr. Sharfstein, you want to take the first crack at that?
Sure. Thanks for asking. So I think it's important to realize that there's almost nothing that we're going to do that's about reopening that is zero risk. Everything is going to have some risk. So the question is, how can we minimize that risk as we're trying to, basically create more economic activity and be able to survive this over a longer period of time. Opening childcare is an issue, particularly for parents who are working, and it may be absolutely critical for them to be able to work. It's important, though, that if childcare is going to be reopened, that it is done safely and carefully. And there's a lot more information, I think, that we will learn about how to do that, but we know some things already. One of them is that we don't want to have many, many kids from different classes mixing with each other. It may be that there was a child care that had like a, 3-year-old room and a 4-year-old room, and then at lunch they would sit together and they would play out in the playground together, and you really shouldn't do that. It can be better to keep the rooms as few kids as you can, and then have the kids just stay in that room. Or if they're going to go out to the playground, that you basically do some disinfection between the kids and the classes go on their own. Those are the sorts of things that actually reduce the spread, because if there is spread in one class, then that class can get quarantined quickly, and then the other classes are not going to be at nearly the same risk. So there's certain things that can be done to reduce the risk. I think that we don't really know everything about the risk to children. There's obviously now a new serious but rare condition that is associated with this virus in kids. It appears to be quite rare, but obviously it can be very, very serious, and some kids have even died. So it's a very difficult situation when there's a small but serious risk, and there is that in a lot of our lives that we have to address. And so parents will have to make their own decisions about what they're able to do. I do think that opening daycare may be very important for different places, so that the economy can get to a point where people can really, do the jobs that they need to do to provide for their families. So as part of that balance, it's very important to be as protective as possible within the idea of opening.
And I think that was a great answer. Right? The only thing I might add, and I agree with everything he said, that if you can try to isolate the classes, if you do have a child who gets it, then you can mitigate the spread. You can measure kids' temperatures going in with thermal scanners and do a symptom check, which we're doing in many different locations now, which also is one more way to slightly decrease the risk. It's not perfect. There's nothing perfect around this. But But I think we're going to have lots of these kind of trade-off conversations as we start loosening things up a little bit. And the trick is to do them and try to mitigate and manage the risk as much as you can. And there's no perfect answer here as we start to do things.
I'm going to read now a question that I know it's coming in over one of the written platforms here, and I do know this is a question that's on a lot of people's minds, and that it's an event that's happening pretty soon on June 1st. That is a date that many of the rental apartments in this community turn over, and there are new tenants of those rental units. And we are a college community. About a quarter of our population are college students, and many of them, and I'm really quite thankful to the two colleges that they made a decision in the middle of spring break not to encourage students to return in late March. I think that may have been I think that had a huge positive impact on why Vermont has done relatively well in this pandemic. But we do want the students to eventually come back, and some are going to be coming back on June 1st. Here's the plan that's been emerging that I know a lot of people really want to hear about, and I'm curious, maybe Dr. Sharson, you can in real time give us a reaction to this plan. Any student that returns, and I think the reasons there's real concern about this is we know a lot of our students will be coming from the New York area or the Boston area, where there continue to be significant numbers of infections, and there's concern about their return being a new vector for infections here in Burlington. The plan that's emerging is that the governor has a quarantine order in place for anyone who is coming to Vermont from out of state. People are supposed to self-quarantine for 2 weeks. And we are going to try to add to that protocol. We're trying to work with the colleges and really know who is coming back, and add a testing element to that quarantine, so that after about a week, those individuals who have come back could get tested, and we could get a better sense of whether they brought the virus with them or not. The thinking being that testing on day 1 might be too soon, but by 7, we have a better idea. My sense is kind of like the conversation we were having earlier. I'm thinking the city or other community groups or volunteers, there may be something we can do to kind of support those quarantines and help people actually succeed at those quarantines, which are supposed to be even stricter than the kind of stay home posture here, where people go out for essential tasks. In the quarantine, people are only supposed to leave for emergency medical aid. But that's hard to do. And I think it may fall to us, the city and partners, to actually help them quarantine.
So the idea is that the students would come back and then quarantine?
Well, if there's a way for them not to come back, that's the first goal. And that we are helping students who don't need to come back get their belongings. There are a variety of things being done if people don't need to come back till the fall. But we're not going to. There's no way to. But they're free individuals in a free society. Many of them may be coming back.
Yeah, I see. And so for those who are coming back, that maybe they would quarantine while they're here. Is that the idea? If they're going to stay.
Yeah, exactly. The governor actually has an order in effect right now that says anyone coming into Vermont from out of state right now is required to quarantine for 14 days, and he is not planning on lifting that before June 1st.
I see. And some people may want to just be in and out, though, and get their stuff, you think?
Our understanding from the state is like parents dropping things off, or someone who's just coming in and out, they're not going to be expected to stay here. If they just want to come, drop off, and then leave, that will be okay.
I see. Well, I think that quarantine is a pretty effective way for figuring out whether somebody is past a potential danger point. And so before people come, they could, quarantine. That would be some level of protection. Once they're here, if they quarantine, that would be a level of protection. 14 days, almost everybody will show symptoms within 14 days if they're going to show symptoms. So there is, again, some risk, but very, very low that they could be infectious after 14 days. So I think that Building that in is pretty good. Now, if you compare that to testing, testing has some advantages because you can find cases of people with coronavirus, but testing has false negatives too. And there are a number of popular tests that might miss 1 in 4, say, actual infections. And so relying entirely on testing is probably not a good idea. Testing can be an adjunct, but fundamentally, it's social distancing that prevents the spread of the virus. Testing, it can be helpful, but isn't really the core response component in my view.
So Dr. Sharfstein, it's 6 o'clock. Do you need to leave us now, or do you want to stick around for one more question here?
I'll stick around for one more question. And
All
just
right,
because
go
I appreciate
live.
the chance to be here.
We're going to go live. Hopefully this is going to work. Deb, if you can hear us, go ahead and ask your question. Sharfstein, it's 6 o'clock. Do you need to leave us now, or do you want to stick around for one more question here?
I'll stick around for one more question.
All right, we're going to go live.
The chance to be.
We go live. Deb, you can hear us. Go ahead and ask your question.
Hi, thanks. I just wanted to ask about gatherings. I just maybe heard your answer that social distancing is the key here. But this is wedding season coming up, and there are a lot of weddings planned in Burlington and throughout Vermont. And my daughter's one of the ones in late August, and we had decided that really it can't happen. Whoops, I'm hearing myself. Hold on a minute.
Okay, I think we got, Deb, I think we got the gist of your question. Thank you for calling in. Sorry, there is a little bit of delay for people who are participating through Facebook Live. That was what was going on there and causing some confusion. But can you speak to that, Dr. Sharfstein or Dr. Leffler? Again, another issue I know that's on a ton of people's minds. On my mind as we try to figure out, is there any way to, we haven't yet fully canceled all the festivals and events planned for the summer. We're getting close to doing that. The governor right now has said, I think people up to groups of 10 are currently allowed to gather. There is an expectation that might be somewhat lifted, but exactly where that will land, I don't think is known yet. How are you thinking about gatherings this summer of any size? If you had a daughter getting married this summer, what would you be thinking?
Well, the first thing is congratulations. It's a good thing. Life is
good point. Thank you.
Is just.
I'm supposed to be the politician, Dr. Sharfstein. So sorry, you had to beat me to that.
That's okay, but it's great that even in the midst of all this, there's some things to celebrate, which is absolutely true. Second thing is big gatherings, particularly gatherings where people are shouting, singing, dancing, laughing, are really great opportunities for the virus, unfortunately, to pass from person to person. And so, like the kind of wedding that wedding movies are made of, I think it's going to be a while before those are really safe, frankly, because especially when people are coming from out of town, and they could be bringing the virus in, and quite a few people could be getting it, as you could see from South Korea, someone going to a bar and suddenly they have a huge number of infections. And so that could absolutely happen at a wedding. So I would expect big weddings to be pretty unlikely for this summer, unfortunately. So people have to find other ways of doing it and, save money for the party later or do other things. I went to a bar mitzvah on Zoom this last weekend, and the young man was extremely did a wonderful job, and everybody was very proud, and people from all over the country were able to come and participate. And from his perspective, he really did what he needed to do. And I think, for weddings, there are ways to decide what's important in the short term and then be able to have the party when we actually make it through this.
Dr. Leffler, do you want to add anything, or?
I think Dr. Sharfstein covered it perfectly. I think there's two huge issues with big gatherings. And number one, it's a lot of people together, typically in a small space. And the one that I was most concerned about is it's bringing in people from a lot of other states. So when those people get here, whatever the disease burden is the state they're in, that's suddenly back in Vermont. When you looked at that map you showed in the beginning that Vermont was in green, but we're surrounded by red. And so when people come here and don't quarantine or don't come and be tested, they're bringing in potentially new cases. And so as difficult as it is to delay these big gatherings, I think that's an important part to be doing right now. And it's tough, it's hard, I understand that. But I think in the short term, that is going to be the reality.
Thank you so much, Mayor, for having me. I really appreciate it.
Dr. Sharfstein, thank you. It's really an honor and great value that you were able to join us, and we'll see you again soon. And we'll just wrap up, I think, more broadly too. It seems like I think the questions captured a bunch of the information that the questions that are coming in. I'm just struck sitting here. We did something like this at the beginning in mid-March, just as the emergency was starting. And then it felt to me, the only thing comparable I can think of is when I was I lived in Southern Florida for a little while, and there was a time when there was a hurricane that was expected to come on shore, and mid-March had that feel to me, Dr. Leffler, when we were down in conference room 12, it was like the hurricane was almost upon us. Now I'm having that sensation. It's very different, right? I feel some real hope. I have this. It's almost like the beginning of a long journey where that there's a lot of good things out ahead. There's going to be some challenges too. A real sense of uncertainty and uncharted territory. But a very different moment than we were in 2 months ago. A much more hopeful one. And one that I think a difference between now and then is that I hope people reflect on and hold on to is that part of the reason we're here now, earlier than just about any state, to be able to responsibly have this conversation about restarting some activities is because of how we earned this, how hard and how much sacrifice Vermonters were willing to make to keep the virus contained. So it is exactly that kind of discipline that is going to be necessary for the journey ahead. And I think we should take confidence into this next stage from this early success. Dr. Leffler, I think you were one of the real leaders that helped get us all in the right mindset for how we had to approach this. And I thank you for your service in that broader community effort, as well as the huge day-to-day responsibilities you've had managing this incredible challenge and doing things with your organization that never had to be done before, like the nursing home support that we talked about. So, do you have any final thoughts you want to leave us with, or?
I think you summed it up nicely. I think to quote Winston Churchill, we're at the end of the beginning. And so now, we're shifting into our new normal, and all of us going forward and doing all the things that we want to do and keeping our people safe and our community safe and our family safe is in front of us. And so I look forward to moving into the next phase. I agree with you. We've earned the right to go forward. And so we can put this first step behind us and then establish our new normal.
Well, we've had a lot of folks with us tonight. I can see we've had hundreds of people on Facebook Live. We've had many hundreds more on the telephone. If you enjoyed this conversation, if you got something out of it, I do want to invite you to, and for those of you that don't know, Dr. Leffler and I have regularly been having these briefings at 2 o'clock on Wednesdays. And I've been doing 3 of these sort of public briefings a week through this Zoom platform at 2 o'clock on Monday, Wednesday, and Friday. I think we're going to stick with that tempo for a while. Also, tomorrow morning, I will be doing what I always do on Wednesday mornings and having an open coffee with the public. We've been doing these virtually during this emergency, and they've been great conversations. I think anyone, if you didn't get a chance to ask your question tonight, join us for the coffee tomorrow or some other Wednesday. We're going to keep doing this, and I think this is our sense of how we get through this together is we keep these communications going and we figure this out together. So I look forward to seeing you all in another forum soon. Hopefully, as we go into the restart, we'll have some more in-person opportunities. But as the conversation tonight, to summarize it, we still have challenges ahead, and we're going to have to be careful and continue to be mindful, even as we move forward and reopen. So with that, have a good night, everyone. We'll see you all again soon.